So without wasting time, let's ask ourselves this question. What is a stroke? There's need for us to ask ourselves this question: what is a stroke? A lot of us give different definitions to stroke, but in this class or seminar workshop, a lot of us will be getting to know the definition for stroke and what it entails. A stroke is more or less your own brain's equivalent of a heart attack. A stroke is your brain's equivalent of a heart attack. It is a very serious life-threatening condition. And how does it happen? It occurs when your brain does not get enough blood flow. When your brain does not get enough blood flow. The most common types that we see are one, either the arteries leading to your brains are blocked, or whether there's a bleeding occurring inside your brain. And once any of this happens, it means that one, the blood will not flow properly to your brain. And when it does not flow properly to your brain, it therefore means that the blood will not be able to carry oxygen to the needed areas in your brain. So if we are having a blocked artery or blocked arteries or bleeding occurring inside of your brain, thereby denying either a section of your brain from getting the needed as well as the needed oxygen, there's every possibility this particular patient will have a stroke. Now, there will be need for us to really ask this question: who does it affect? Who does stroke really affect? To answer this question, there's need for us to understand that stroke can affect anybody, including children. Even though strokes in children are rare, it still occurs and is among one of the top 10 causes of death in children. For adults, we know they stand a higher risk of getting stroke than children, and it's even more higher. 2/3 of stroke happen in people over 65 years of age. So we have the elderly having more likelihood of getting a stroke. Now, there are medical conditions that can increase the risk of an individual getting stroke. What are some of the conditions that can increase your risk of getting stroke? One, we have high blood pressure, the one we refer to as hypertension. We have hyperlipidemia, that is high cholesterol. Then patients with non-insulin dependent diabetes, that is diabetes type 2, are more predisposed. These people are more predisposed to getting a stroke. Now, we have certain people with a history of stroke in their family, and those with irregular heart rhythms, the one medical personnel refer to as atrial fibrillation. Now, any of these persons mentioned with this kind of diseases have a high risk of getting stroke. Now, how common is stroke? Please, there is need for us to know this. How common is stroke? Stroke is very, very common. It's so common nowadays. According to the World Health Organization, around 15 million people worldwide experience stroke each year. Please, I would like to take that again. For some of our students that are writing one or two things down, according to WHO, around 15 million people worldwide experience a stroke each year, with 5 million dying and 5 million permanently disabled from stroke. So stroke as it stands is the second leading cause of death globally after cardiovascular diseases. accounting for around 9.7% of all deaths globally. Now, if we go back and begin to ask, is it one particular type of stroke that is causing all of these deaths? At this stage, let's begin to distinguish them. There are different types of stroke. We have one medical personnel referred to as cerebral infarction, that is ischemic stroke. It's about the most common type of stroke that occurs or often seen in patients, accounting for 48% of patients that come down with stroke, cerebral infarction. Another name for it is ischemic stroke. We have another type of stroke that medical personnel refer to as intracerebral hemorrhage or hemorrhagic stroke, and another type referred to as subarachnoid hemorrhage. So we have hemorrhagic stroke. Hemorrhagic stroke can be broken down into two. We have the intracerebral hemorrhage as well as the subarachnoid hemorrhage. We are going to see it as we move further into this discourse. Then we have another type of, though this one is less common, but then in this lecture, there will be need for us to discuss it. It's referred to as transient ischemic attack, that's TIAs. Now, if you look at the percentage of these different types of stroke globally, the ischemic stroke tend to occur more, followed by hemorrhagic stroke, and last by the TIAs. If you look at the global burden of stroke worldwide, you'll be so shocked that the entire globe has really been encapsulated by this particular disease. The global burden is the place. Before we do that, I will ask that we wait a bit. The report before us shows clearly that there are 3 regions with the highest estimates. Eastern Asia. If you look at the map before us, you see Eastern Asia. Which countries are found in Eastern Asia for some of our students that are not too good with geography? Countries like China, Hong Kong, Mongolia, North and South Korea, Taiwan. You find these countries in East Asia. They account for around 38.8% of the stroke burden globally. Central Europe accounts for around 0.7% of the stroke burden globally. 1.6%. Then if you look at sub-Saharan Africa, we only have around 11.8% of the stroke burden globally. But that does not mean that it is a huru for us. For us to begin to celebrate because someone appears as a matter of fact. If we look at the Nigerian situation, your celebration will be cut short. Why? Because the prevalence of stroke in Nigeria is 1.14 per 1,000 people. Now, if you look at the incidence, the stroke incidence rate in Nigeria is estimated to 100,000 persons, with a more higher incidence in men than in women. If you look at the bar chart before you, you are going to see, just like I said in my opening, children do have this disease, but we tend to have more, more of this condition as one progresses in age. What are the different types of stroke? In my opening, I was able to give you the different types. There are 2 major types. Then we have the subtypes. There are 2 major types. For those that are joining us now, we are looking at stroke management. And for us to be able to manage stroke, we should be able to know what stroke is. And that is exactly the lecture that is coming to us today, courtesy Super Life Nigeria. And you're not late if you're just joining us. We are looking at the different types of stroke. there are two major types. Two major types. We have the ischemic stroke, equally known as cerebral infarction, as well as hemorrhagic stroke. The hemorrhagic stroke can further be broken down into two types. We're looking at the hemorrhagic stroke. We have to look at two types for us to really understand what hemorrhagic stroke is all about. We have the intracerebral hemorrhage as well as the subarachnoid hemorrhage. Then we now have a mini type of stroke called the transient ischemic attack, TIAs. Now let's dig deep into these different types so that we can have a proper understanding of these different types of stroke. Let's start with cerebral infarction, that is ischemic stroke. Now, this type of stroke occurs when cells don't get enough blood flow. When cells, which cells are we looking at? Cells in your brain, when they don't get enough blood flow. And when they do not get enough blood flow, it means they will not get enough oxygen flow. And what will cause this? This type of stroke can happen when there are blockage in the blood vessels in your brain. Once there are these blockages, you now find because of this of their audio, please.
What is going on?
Those whose audios are on, please, they should turn their audio off, please. They should mute their audio, please. Thank you very much. So we are looking at cerebral infarction. So we said this type is when cells in the brains do not get enough blood flow. And when they don't get enough blood flow, it means oxygen going with the blood will not get to these cells. And how will this one happen? This can happen when there's a blockage in the blood vessels that are in the brain, cutting off this blood flow. So once this happens, we now find out that the cells in the brain begins to die off. If you look at the diagram, before you, and the hand lens that I have used to zoom in into your blood vessel, you can see how that particular blood vessel has been blocked or cut off from blood supply inside your brain. Now, we said there are so many factors that can lead to this. One, people that are always having high blood pressure, hypertension. Please, if you know you are listening to me right now, and you know once in a while your BP goes up a lot, you are a hypertensive patient. Do everything possible to ensure you are always doing a checkup. Why? If you don't, you stand the risk of having this kind of condition happening inside your brain, where your blood vessels are cut off from blood flow and oxygen flow. Another group of people that stand the risk of getting this type of ischemic stroke are those with high blood sugar, diabetes type 2, the one we refer to as non-insulin dependent diabetes, and those with hyperlipidemia, that's those with high cholesterol. So it will do you good if you constantly check with your medical lab scientists to check one, your blood sugar level, your cholesterol, and check with your nurses and doctors your blood pressure. The second type of stroke is hemorrhagic stroke. Anytime you hear hemorrhagic stroke, please, your mind should go to bleeding inside your brain. Bleeding inside your brain, where the blood vessels begins to bleed. What will make your blood vessels bleed? Two things can happen. Two things can happen to make your blood vessels bleed. The first is one particular type of stroke we refer to as intracerebral hemorrhage. Intracerebral hemorrhage. If you look at the term intra, it means inside. So this particular type, the blood vessels inside your brain tear up or break open, causing bleeding that puts pressure on the surrounding brain tissues. So when your blood pressures inside your brain for several health reasons that you may be putting yourself through now allows your blood vessels inside your brain to now break open or tear open, you now find blood cells gushing out inside your brain. So when this one happens inside, this type of hemorrhagic stroke is referred to medically as intracerebral hemorrhage. Then we now have another type of hemorrhagic stroke that we refer to as subarachnoid hemorrhage. This one, if you look at the brain, there's a covering on the brain. Now, between that covering, that is, between the covering and the brain itself, you now have bleeding taking place there. Let's look at the second diagram in order for you to understand this particular type of hemorrhagic stroke, the subarachnoid hemorrhage. In the diagram before you, I've been able to present the surface of the brain where you have the covering on your brain because your brain has a covering. So between that covering and the brain itself, bleeding occurring there. This type of bleeding can occur once there's a head trauma or once there's a punch, a heavy punch to the brain, maybe from an injury in an accident. You now find that particular place bleeding. So this type is another type of hemorrhagic stroke that can occur. And in my intro, I was able to give you a percentage of patients globally that have been diagnosed with subarachnoid hemorrhage. If you do remember, I gave you a figure of 11.3% globally. That means there are people who are suffering from this type of hemorrhagic stroke. Let's look at another mini type of stroke. Those with this type of stroke, though they are few, globally, they account for around 1.9 to around 5.1% of people suffering from this type of stroke globally. But that does not mean we should overlook it. The mere fact that people are getting it, it means any one of us too can get it. What is this type of stroke? It is a mini stroke, yes. So it's we refer to this type as a temporal stroke. Why? Because it occurs when blood flow to the brain is briefly interrupted. Please, I would like us to underline the word briefly. When blood supply to the brain is briefly interrupted. Are you getting it? It happens once in a while with people. And then you now find the person feeling a bit dizzy. It occurs for a while, and after sometimes the symptoms just disappears. And sometimes when the medical personnel gives some drug, you now feel better. It comes and it goes. The person feels a bit dizzy, finding it difficult to walk, losing balance, trouble seeing very well with both eyes, and there's lots of coordination. But even at that, after some time, the person bounce back. And this one occurs when there's a blood clot within the arteries in the brain. And once this clot clears, you find the person bouncing back. So it's a temporal type of stroke. Now, what can cause a stroke? I have mentioned clearly in my opening and in the course of explaining the different types of stroke that one, hypertension is not good, hyperlipidemia is not good, diabetes type 2 is not good. What other condition can really make you suffer from stroke? We have arteriosclerosis, which is chronic inflammatory disease that occurs when plaque builds up within the walls of your arteries, thereby narrowing blood flow. Medically, we refer to this condition as arteriosclerosis. A patient with clotting disorder can equally be predisposed to stroke. Other conditions are atrial fibrillation. That is a heart condition. That's where the patient is having irregular heartbeat. Irregular heartbeat. So people with this kind of situation are predisposed to stroke. And we see this a lot with patients who have this condition, sleep apnea. You find some of them devices before they can sleep. Why? Because during sleep, the passageway is blocked. So medical personnel help them with this device that they wear when they sleep, those with sleep apnea. Yeah, they can easily be. Now, we've equally seen situations where there are certain human beings with certain heart defects, referred to as atrial septal defect, that is a hole in the upper chamber of the atrium in the heart. Then we equally see another type that is lower chamber of the heart that we refer to as ventricular septal defect. So people with this kind of medical conditions can equally be predisposed to having stroke. We equally know a condition like microvascular ischemic disease. This type of disease can equally block blood vessels in your brain. So people with this kind of diseases are predisposed to having stroke. So don't forget, I've mentioned high blood pressure before. Those that have brain tumors too have a higher chance of having stroke. Now, let's look at other related conditions that can predispose you to stroke. For those who take alcohol a lot, we see in our country today how people take sachet alcohol. If you look at the constitution of how the sachet alcohol or what it contains, to be candid, a lot of people are predisposing themselves to stroke later in life. They are just buying time because of substance abuse, especially alcohol in our world today, especially in Nigeria. Everywhere you go, you find sachets, alcoholic sachets. Both male and female are just taking it, especially here in Western Nigeria. Please, if you know you are doing this, kindly take our advice today, stop it. Remember, I mentioned cholesterol, hyperlipidemia. Once in a while, please do a check of your cholesterol level. Those with diabetes type 2, I'm not discussing this again because I've overemphasized on this. Then those who smoke. In all our lectures, we keep on hitting hard on smoking. If you know you are still smoking, better stop it. You will be doing yourself lots of good. Those that abuse drugs, sometimes you go self-medication, you leave our pharmacy, you leave our doctors, you are now engaged in self-medication. Please, you are predisposing yourself to stroke. Why? Because these drugs you are taking were not prescribed. You prescribe them for yourself. And when the repercussions come, you have yourself to blame. Now, how are strokes diagnosed? At this point, I want to invite my colleague, a pharmacist from Ifeanyi Chilaka. Please, are you there? I want to invite him at this juncture to take the next stage of today's lecture. Fam, are you there?
Yes.
Hello,
good evening, sir.
Chilaka.
Yes,
Yes. Are you with
sir.
us? Please,
yes,
I want to invite you on board to take this stage of diagnosis, treatment, and I will come back during the prevention. Thank you very much.
Okay, sir. Thank you very much. Yes. Thank you very much, sir. Good evening, everybody. I'm to speak to us on stroke and management or treatment of stroke. Basically, the first part of the diagnosis, of course, when the patient maybe comes down with stroke or is beginning to have certain manifestations or symptoms that may precede the stroke itself, or that may suggest stroke, and the patient is before maybe a cardiologist or even a GP, sometimes family physicians, because they are the first call of doctors that patients would see when they visit any hospital or health institution. You can't just walk into the hospital and run straight to the cardio clinic or the neurology clinic. More often than not, if it's a teaching hospital or a tertiary institution like the Federal Medical Center, all right, or some general hospitals, you're most likely going to encounter a GP or a family physician. That's family medicine. And one of the things the doctor would do there is to check out for certain neurological signals. I mean, neurological examinations. You understand? Because if, for example, they may lift your hands up, you will look at your eyes, and then you may be asked to speak. All right, because one of the things or one of the areas that stroke can affect is your speech. Of course, you know the left and the right hemispheres are culprit here. So if we want to look at certain neurological examination, neurological indications, can you sometimes they will pinch your skin to know if you can still respond to those stimulus or stimuli. All right. So if you are being pinched and you don't feel it, sometimes they will do that at both sides of your body, the left side, the right side, your left hand, your right hand, your limbs and all. It's to know if it is actually a holistic stroke or is just a partial stroke, all right? Or what kind of stroke it could be, whether it is ischemic or it is hemorrhagic, all right? And so those are basic neurologic examinations that the doctor would do firsthand to know or to be able to diagnose if the patient is actually if the problem is stroke. Because like doctor has rightly said, when we talk about stroke, the first thing your mind should come to your mind is the brain. All right, the brain is the major organ that is affected here. Of course, there are quite a number of vital organs in our system, which I believe doctor has mentioned while he was talking: the brain, the heart, the liver, and the lungs, and the kidney. And so all these organs have some kind of interconnectivities. You understand? So the doctor will also be looking at certain things to know if any of these organs could also be affected. All right. You will look at your eyes. How are your eyes rolling? And so these are just basic neurological examinations to actually ascertain if the brain is 100% all right. And these are they are just basic physical examinations. You understand? And then when that is done, just to continue that, there is also a CT scan. A CT scan that is also done. This due the HCP, either the neurologist or the whoever is handling that patient, they will quickly look at the brain if there any problem there. And so that's basically what the CT scan would do. It's not harmful. It's not also difficult. It's a straightforward test, which you always find it in basically a scan we do. Is just to scan and evaluate for certain ischemic signs or even hemorrhagic signs, as the case may be. And then you also have lab tests. Lab tests. Why is the lab test done? Your blood samples are being collected, and then it's being checked for certain components. When the blood is being, they will run, of course, ABC tests, run all those blood tests to know if there's an infection, if there's any sign of infection, because if there's any sign of infection, it simply means that there could be a damage somewhere, because an infection will only arise when there has been an inflammation or a damage that would give room for the microbes, all right, to invade that territory. So if there are if there are collections, if there's a presence of an infection in certain area, you know, and then it could be that it could suggest that okay, there could be stroke somewhere, and then you look at the blood clotting agents. All right, if you have the plates, if you have those and the blood clots, if you also have them present, of course, you know the clots will only arise when there's an injury. All right, so if they also see those presence of those proteins, it could also serve as an indication or an indicator that something around stroke could be present there. And then, of course, like I said earlier, the heart, the brain, the kidneys, the lungs, these organs are all interconnected. There's what we call comorbidity. When one organ is affected, more often than not, the other won't be affected. That is why in internal medicine, you have a patient that is being seen by an endocrinologist, that is a kidney consultant. The same patient will also be visiting the cardio clinic. Perhaps the same patient will also be attended to by a neurologist, because these organs are all interconnected. So there is a high likelihood, higher chances of patients who have diabetes or have high level type 2 diabetes to also come down with stroke. Over 65% of patients that have suffered or that have diabetes usually come down with stroke, because if you have a high level of sugar or glucose in the blood, of course, when you have a high level of glucose, or definitely the blood pressure would rise. And if the blood pressure rises because of the presence of the sugar or the presence of certain proteins or competent proteins that you have in the blood vessels, of course, what happens is that there is pressure on the blood vessels, and if the blood vessels are so pressured, if the blood pressure is quite high, you may have hemorrhage. You can have the rupturing of the blood vessel, or you simply may not have free flow, because if the blood vessels, which are channels, all right, through which the blood is being passed from the heart to other organs, especially the brain that takes up over 75% of body glucose. And so if the blood vessels that are linking up the heart to the brain are affected because of blockades, and these blockades could be as a result of sugar, all right, high sugar level in the blood. So you see the correlation between diabetes and stroke management and cardiological or cardiovascular problems. So they are all connected, all connected. So that is why there's also a need to run a blood sugar test, all right, to also know the concentration or the level of sugar that you have in the patient's blood. And then, of course, like I said, the kidneys, the liver functions are also being looked at, because when there is a stroke, or when the brain is affected, more often than not, these other organs could also get into play. They may also be affected. There is a likelihood that these other ones will be affected. And so it is important that the doctor also checks for these organs by using certain tests to be sure that these organs are still okay. And so if there is also a problem with any of these organs, it could also suggest that, okay, this could be stroke. All right. Okay. And then usually they run an ECG, which is electrodiagram, and basically is to make sure that the ECG is majorly done by the cardiologist. Is basically for the heart. All right. So once you see any word cardio, the word cardio connotes heart. So the ECG is basically done to be sure that the problem is not the blood vessels that are connected from the heart. And of course, that's ischemic stroke. And if it's any blood vessel, the artery that is carrying oxygenated blood from the heart to the brain is what is affected. That's ischemic stroke, and that could be a major problem. All right. So the ECG is done to be sure that the heart is not actually the source of the problem. And then MRI scans are also done in some cases. It's far more sensitive than the CT, and then sometimes you can also have EEG, electroencephalogram, all right, which is you majorly do this when a patient is having certain neurological when you suspect certain what they call it neuropsychotic symptoms or neuropsychotic problems. All right, that's when you actually do this, because sometimes you have certain displays of sparks, that you see seizures. You see the patient coming down with seizures repeatedly. All right, so when all these so that's when you do that test, just to confirm that. All right. Okay, so let's move on to the next slide. How do you treat stroke? Basically, of course, you must have done your diagnosis to know what kind of treatment regimen or treatment options that will be adopted in managing that patient. Is the stroke ischemic? Is it hemorrhagic? All right. And of course, if it is ischemic, like doctor has rightly said, the blood vessels, excuse me, there's the link between the heart and the brain. All right. The blood vessels that connect that has been there's a build-up of certain materials, okay, that could be as a result of sugar, that could be proteins, could be thrombins, all right. And of course, when that happens, you have what we call atherosclerosis, all right. And so the first thing you want to do, because oxygen is the most important mineral. Oxygen is the most important mineral to the body. The brain, I said, takes up over 75% of the oxygen consumed by the human body. So immediately there is any kind of blockade, immediately there's any kind of deficiency of supply of oxygen to the brain, it's like the CPU, the central processing unit, the computer. Once the CPU is down, the monitor and every other part of that system is as good as dead. All right. So that is why the first thing you look at is, okay, what is the nature of this? How do oxygen supply? So for you to restore oxygen supply, ultimately, whatever has been causing that blockage, you find a way to what? To remove it. You understand? You decongest that place so that you can have free flow or free passage of oxygen to the brain. And one of the things you observe is that sometimes the person begins to behave like in such a way that looks like a child, a little child. Have you seen a patient that has stroke? They begin to behave in certain ways because the brain is now weak. The brain is weak. What powers the brain is oxygen. And you need the brain to also regulate every other part of the system. So when the oxygen supply is cut short or is blocked, if it is completely blocked, the person most likely will not survive it if attention is not given to that patient in time. Because the brain can only survive for a few minutes without oxygen. So now you find the best way possible quickly to restore oxygen supply. And in doing that, you can use certain medications, anti-thrombotic medications, that will quickly decongest that place. You understand what I'm talking about. So you use either antiplatelets, you have antiplatelets, or like aspirin or clopidogrel. All right. All these medications, what they will simply do is that they will simply decongest that place, remove the plaque, or rather remove the thrombus, so that you can have a free flow of oxygen. Now, but there are certain medications, like I said earlier, the thrombolytic drugs, they are being given within the first 3 to 5 hours. Within the first 3 to 5 hours, those drugs have to be given so that you can quickly decongest the blockade, and then you can have free flow. After which, you now continue with antiplatelets or antiplatelets like aspirin or clopidogrel or other medications that the prescriber or the HCP may find more useful depending on what the situation presents. All right. It could be warfarin, it could be heparin, heparins like enclexane and all that, just to ensure that that airway is opened up. And then there are also mechanical thrombectomy that are also done. They are also done within 24 hours. All right. This one is not an easy thing to do. You have to insert catheter, all right into the blood vessel, and then you can find a way to remove the clots that is in the brain. All right. That is basically that. And then you also look at the blood pressure management. Of course, you have to find a way to manage the blood pressure, because the blood pressure most likely had caused has resulted to the what's it called, the stroke. All right, the pressure there is so high because the blood can't find a way to pass, and so you put so much pressure on the walls of the vessels. So you must find a way to also bring down the blood pressure by using antihypertensives. Of course, there are quite a number of them. So it depends on what the doctor finds more useful. Is he going to use a calcium channel blocker like amlodipine? Is he going to place the patient on Vasartan, or whatever the medication is? It has to be an antihypertensive just to bring down the blood, and then you can also introduce clotting support like the use of vitamin K. And then in some cases, rare cases though, you may have to do you may do a surgery, all right? You may do a surgery just to ensure that you restore the ruptured and blood vessel quickly. That has to be done but on rare occasions, anyways. So I think that will be done on treatment and management. Over to you, sir. Okay, we also have this speech therapy. Okay, I didn't see that speech therapy. That this one is actually post chemotherapy. I mean, by the time the patient is being stabilized, all right, you need to now find a way to rehabilitate the patient. And in rehabilitation, a lot of departments are involved here. You have physiotherapy. Physiotherapy plays a very key role here, all right? And then you also look at I've forgotten the name they call that department that handles the speech therapy here. And here you have to because of course, the stroke has affected the person's speech, cognitive functions, how the person moves about, and even the locomotive functionalities. And so you need the physios around to also help to get the person fit again to do those basic things. But these ones will come when the patient has been saved, when the patient has been properly managed. That is when this rehabilitation will come in. So the point we are saying in a nutshell is that stroke is a very deadly, it's one of the top 10 cause of death globally. And so it's not just a discussion for us to just take for granted. We need to take it very seriously. Always ensure we check our blood pressure. All right. Thank you very much. Thank you, Dr. Igbe. I think I am done here, sir.
Thank you, pharmacist. I think, Dr. Igbe, I saw Dr. Chooks. He's on the floor. Hopefully, you can give him floor to really went through the management. Again, we're using our life echoes.
I will give him the floor once we get to the Super Life product. I will hand it over to Dr. Chooks.
Okay, go ahead.
I want to appreciate our pharmacist, Ifeanyi Chilaka, for doing justice to the issue of treatment. When our Dr. Chooks come on board, he will still throw more light, especially using our Super Life wonderful product. But before we do that, please, there's need for us to prevent this disease from happening. Please, all of us listening here, do your part to prevent yourself from getting stroke. Either is the ischemic type of stroke or hemorrhagic stroke. Please just do your best to avoid it. Now, how can you do your best to avoid it? Number one, your lifestyle. Your lifestyle. I keep on emphasizing. Do you smoke? Stop it. Do you take sachet alcohol or any form of alcohol? Please stop it. You tell yourself you are enjoying life. Please, you're only heading to your grave early. Stop those things. Avoid all these risky behaviors. Why? Because it will not do you any good. Stay healthy, eat well, sleep well. And when we say eat well, please, it is not bread and mineral. When we mean eat well, go back to what your forefathers were taking. Some of us have left it, and we are paying dearly for this. manage your health condition. Make sure you do not get diabetes, and if you do, manage it very well. Let the doctors, the medical personnel supervise you. The issue of high cholesterol, always be in the lab to check your cholesterol level. Always be with the nurses and the doctors to check your blood, your blood pressure level. Don't forget, high blood pressure is the one responsible for hemorrhagic stroke. Please don't allow yourself to get stroke. Another, just give me a minute. What were our forefathers? We like doing this in our program. The reason why we do this is not to advertise herbs. No, but it's to let us know that we are Africans. And that the reason why our forefathers live long, we need to truly re-emphasize it in our programs. Because the herbs forms part and parcel of our diet, daily diet. A lot of our modern families are living the normal, traditional, conventional ways of eating. They are eating the Western ways, and because of that, they are getting Western diseases. They are now making the charts in sub-Saharan Africa to go up. If you look at stroke, we have more of stroke in Eastern Europe, Central and Western, East Asia, Central and Eastern Europe. If you look at sub-Saharan Africa, it is beginning to go up. In the past, it was very, very low. And what were our forefathers doing that we are not doing? Please, I keep on emphasizing on this. You remember in our last lecture, we talked about the food our forefathers were eating. Number one, we mentioned bitter leaf. Bitter leaf is rearing its face again. For some of you who hate eating bitter things, this bitter leaf is rearing its head again. You remember in the chart we looked at how the Easterners were low in terms of one of the cancers. Why? Because they eat more of this leaf. Please, it is here again. To avoid it, please use it. Use it. It is a very good cleanser of the body. Water therapy. A lot of us do not know that water is a therapy. Water, drinking of water. How many of us, when you wake up in the morning, you can drink at least 3 to 5 cups of water without brushing your teeth first? It is recommended by experts. Research has shown clearly that when you wake up from sleep, take at least 3 to 5 cups of water before you brush. It will help your body. Most of us don't like ginger. Only very few people drink ginger tea. In our villages, there's a way they drink tea using ginger. And you begin to ask, why is it that they never had either ischemic or hemorrhagic? We have left this form of eating and we are paying for it. Now, another thing again is we just eat pawpaw. We don't know the value of the pawpaw leaves. We eat avocado pear. We don't know the value of the fresh avocado leaves. Our forefathers know the magic one. Why? Because they know a combination of pawpaw leaves and fresh avocado pear leaves and boiled, taken like tea, has a way of dealing severely and driving away anything that can lead to stroke. So please, let's go back to our forefathers. But in the event you cannot, this is where we are. At this point, I want to invite my brother, Dr. Chooks, to use all that I have said concerning what our forefathers were taking in before the advent of super life products. Dr. Chooks is going to do justice to that. Please, doctor, are you with us? Please, over to you. Hello, Dr. Chooks?
Hello, Dollar King, are you hearing me?
Yeah, I can hear you. Yeah, go ahead. Doc, we can hear you. Go ahead.
Oh, the network, this is my end. The network. Stroke, I've listened to, was trying to get some hint from their teachings because network was throwing me off and on. Stroke management stroke management is also time-based management. It takes time to really get rid of a stroke and manage a stroke. because it's an accident. The accident that has to do with the brain. So that's why they call it therapy. Has good prognosis for stroke management. So we make use of our ST30 and the XNC. While some other case, we also add the SIC. And the basic mechanism for mechanism of action for management of stroke using a super life product like SNC is that we have seen from the lecture they gave, which is of course what causes stroke, what are the complications that result from stroke, what are the risk factors that are associated with stroke. Once there is free blood flow in the brain, if the free blood flow is restored, oxygen flow is restored, the vessels are of clot or thrombus. There will be fast does that a lot. It facilitates dilation of the blood vessels, and it helps in dissolving that clot in the blood vessels. So it also helps in the building of nerves in the brain to foster communication. Communication in the sense that to foster circulation, perfect circulation in the brain. So SuperLife also activates the two important structures in the brain that are activated by SuperLife. Oligodendrocyte and astrocyte. Oligodendrocyte and astrocyte are the two organelles that are destroyed by stroke. And this oligosynaptic chemical message from the brain to from the body back to the brain. Stroke, one part of it sometimes most rarely of the body, but most of the body. And you know, at the hind part of the brain.
Sorry, the doc is seriously the network. The network on his own end is very, very terrible. But I think he has passed his message. I believe if he can come back, I will want to encourage us to make sure you assess the health manual. He happens to be the head of the team of consultants from WHO that really package that health book after they have really investigated and tested each of our products. They use their catalog of all the known health issues to really package that wonderful health manual. That's a Super Life Supplementation Therapy manual. Please, if you have not gotten a copy, it's just like a doctor in your hand, in your home. Every home needs to have one book, one copy of that booklet. And if you have anybody who is having all these serious health challenge, terminal health issues, even the ones that we have discussed so far, ranging from cancer, cervical, breast cancer, prostate cancer, infertility, malaria, whatever, typhoid and whatever, and many other the list is much because the booklet contains a lot. And the way the table of content on how to administer the product, so how you can combine them, the duration, everything is well defined. Please do yourself a favor to have a copy, and you can be your brother's keeper in terms of extending it to somebody who you see is having such health issue. Just give it to the person, let them check and get themselves. Here is a total package. Somebody was in my office yesterday, just SIC. He saw a lot of active ingredients. He began to mention each one of them, that so-so company is using this one. So-so company is using this one. He mentioned over 13 different active ingredients that is in SIC, that different companies are using just one of them to really have a product that they're marketing. But all of them are in one of our product in our pack called SIC. So the same thing with SNC, the same thing with STC 13. Sure, that is the one that's the major game changer. Please, we are talking about when someone is already in the midst of the mess of ailments. This product that you are seeing here, the three of them are very important. It is going to work down to the cellular level and bring life back to such ailing body. Then, if you are not sick, we need to maintain our body. It's a powerful machine. And when you see a machine, an engine, that you don't service regularly or per time, definitely is bound to break down. Our body, even while we are still in our mother's womb, those machines they are working right in the mother's womb. When they give birth to us, the machine has been working like our heart, every part of our system. So this product you are seeing here is meant for us to use it to maintain our health. You don't need to wait till you fall sick. That's why the slogan that says that prevention is better than cure. If you truly love yourself, you should never allow yourself to be an object of a fire brigade. They are looking for the best hospital. They are looking for the best patient. They are looking for the best drug. It does not depict that you truly. So for those who truly love themselves, you must be apply proactive measures. So thank you. I want to give Dr. Rose.
Hello, yes, I can hear you. Yes, I can hear you.
I still having a lot of issue with the network. Maybe it is where he is. The network is very, very poor. So I don't know. Can we just do you still have you want to conclude?
Let me just summarize.
It's okay.
Yes, all those that have attended today, I want to appreciate you, students, adults, those here in Nigeria and outside of Nigeria, that are constantly, keying in, connecting to this our lecture every week. The good Lord will continue to strengthen all of you. Now, we want to do the reason why we are on air every week is to ensure that as many Nigerians as possible are healthy. If you look at life expectancy in Nigeria, it has really reduced, and it is reducing daily. While other nations are celebrating the at over 100 years, our own people here, we are dying more before 50. So please, there's need for us to really let as many people know about what Superlife is doing. We are not compelling you to get the product, but if you love yourself, get it. That we are bringing this education, this awareness to as many people as possible. So please let others know so that at every week lecture, we have more people coming in. Then you can always go to our website and look at previous lectures and see how you can learn. You can pass it around, send it to friends and families. So once again, please avoid the different types of stroke. Make sure you don't get it. Thank you very much. I want to hand over to our High Chief. Thank you.
Okay. Thank you, Dr. Ebe. Thank you, pharmacist Famifai. Thank you, Dr. Chus. That you really have done justice. Please try to reach our YouTube channel, which is a Super Life Lagos or Super Life Revolution Movement on the YouTube. You'll be getting some of the previous topic we have treated. So please just go there for reference purpose and you can help yourself. I would like Coach Sampson, please, to just the packages of how to be part of Super Life if you desire as a customer or as a business partner. So I want Sampson to use the next 15 minutes to tell our new audience or participants tonight the packages. Coach Sampson, are you there?
Super Life.
Life is super.
Good evening, everyone. Thank you so much, Dr. Rood, Pharmacy Ifine, and Dr. Chooks for that wonderful and expository lecture on stroke. You know, it's one of the common or dangerous diseases, particularly for middle-aged people and elderly people worldwide today, particularly also in Nigeria. So thank you so much for that information. So having listened to their wonderful lecture, and you are now thinking of how do you be part of this ecosystem